gonna help me with this one?
Yep.
Good.
Do you want another 12 cc?
Yes, please.
You like this station right, so.
Yep. Yeah, I know that is well done.
That was the big shot.
So these could be boards.
Okay, well, that would be an advantage for us, probably. There would be a little bit less laceration.
Yep.
On the joint capsule, and possibly for small joints, a little bit less in the way of bleeding.
Okay. Obviously they're.
In fact, ours are typically more, they're pointed but not sharp pointed.
Yep.
And that's part of the force that's required to push the cannula into the joint cavity, is just not having a sharp edge to lacerate that joint capsule. Anyway, just a thought.
Yeah, no, great.
This is a pretty cool system.
You need a roller. So do it like that again. You did it? You got it? My glove. Do it here.
Should the overhead lights off.
No, that's very good. Right there. There you go. Now where it's
So that's a little better. We'll capture that one, huh? So that's that button right in front.
Nope, it's the
Oh
one
no, that's
to your
the.
left.
Sorry, yeah, that's the.
On the triangle. It should click. There you
So a few little, see that little cartilage fragment. I probably created that going in. Much better, huh?
much better. Unbelievably better.
Maybe you guys just sort of fine-tuned something when you were playing with it a
go.
minute ago.
No, I think that's what happened. Plus
You can see
it's
the-
your second one now, so.
The swirly nature of the joint fluid, though, really does. There is a refractiveness to it that interferes with the clarity of the image, so maybe a little bit more flush than normal. Good. So that's synovitis over there in the medial compartment of the shoulder.
That's rolling. No. I'm gonna ask him to comment on it. Ready to roll that?
That's rolling.
It is rolling.
Yeah.
Okay.
I'm just taking pictures,
Okay,
extra
sure.
pictures
Do you
of
want to
this.
comment on this in terms of what you're seeing? And
Yeah, so we're seeing much better quality images overall than we found with the elbow. Clear visualization of cartilage surface. Seeing some synovial frons. Now, if I just stand here momentarily, that should focus a little bit better.
Yep,
Is that right?
correct.
If we flush a little bit, maybe that helps.
Yeah, you can see the flash.
And then I hit the light button up front there once.
Yeah, you can try.
I think. Can I
Yeah,
go
try.
back?
You can try hitting it right now while you're in there. That might adjust. There you go.
Yeah.
I think it's just
Okay, so that's good.
changing it
That's
however
good.
way you want.
Yeah.
It's, I can
Figure
Except those eyeballs and horses.
we do have quite a few.
But this is right up. So this is all good.
There, can you push about a mil in there, Amy? Would you-
So the first procedure, I would think, was a technical issue as well as just a learning curve issue.
Mhm.
I think in terms of getting close proximity here, you're
Another mil? Bubble or something. So that right there is, there's a little bit of bleeding, not a big deal. That's a cartilage laceration. I probably created that. Can you come around to my right? And I'm just gonna have you manipulate the leg a little bit. And we'll flex and extend some. So put a little traction on the leg if you would first. And we'll open up the, yeah, there we go. Okay, so medial joint capsule. And so this is an example of where with shoulder arthroscopy, the 30-degree oblique nature of the scope is really important because we would be able to flip it upside down and be looking down around that very curved caudal humeral head. And so just sort of getting used to maybe not having that capability is important. Now the humeral head is coming into view as I pull this out just a little bit, and that's what's that articular surface on the bottom. And maybe just a little squirt there. So this would be really nice for evaluation of classic shoulder cartilage pathology in the dog. Like this degree of visualization would just be awesome. And a recent paper did describe that we're missing those lesions more often than we know because we depend upon the radiograph and the subchondral bone defect, but in fact they do have cartilage defects maybe even 35-40% of the time with negative radiographs. So this would be a value there. So this is, again, some bleeding in the joint, but some synovitis and hypervascularity of the medial joint capsule. But it's not dramatic. It's not dramatic. And that sort of yellowish structure on the other side of that tissue there is the caudal limb of the medial collateral ligament. That's the labrum up on the top, that kind of white shelf. And then following over into the cranial compartment of the joint, all the way down here. There, another mill.